With the USAID funding freeze affecting countless careers, many professionals in the global development, sustainability, and humanitarian work are facing uncertainty like never before. In Kenya, more than 40,000 USAID workers have been affected by the funding freeze. Joseph Okutoyi is a former counsellor at Liverpool VCT and a father of 5, 2 girls and 3 boys. He now lives with 4 of his children in Sinai, Viwandani Ward, Makadara Sub-County in Nairobi County. His wife and one of their daughters went to live up country.
I used to stay in Moja, that is Inako, but when things started changing, you hear rumors. My cousin was he used to live here, where we are at the moment, and he happened to get a job in southern Sudan, and I think Sudan, let me call it Sudan. And then I happened to ask him how much he was paying the rent and everything. Then he told me. Then I told him, no, the best thing I can do, because I don't know what is happening and I have school fees and all that, you're gonna not to leave the house alone. I better change to the house.
Okutoyi was advised by his wife to move from Umoja Estate to a cheaper house in a cheaper estate before the situation got worse, a move he says he will always appreciate his wife for. As a family, they hoped that the situation wouldn't change as the rumors continued to spread about the funding freeze, but this was not to be, as the freeze was announced in January and the stop work order was implemented.
I tried to resist because of the lifestyle, but I was to accept. Most of the people right now as we talk, they are jobless. Some of us have families. Some of us had their own projects. The projects now are at a standstill. You can't do anything beyond whatever you had already started. Some of them, or some of us, have loans to pay. Now life is devastating because we don't have any other avenue.
As a counsellor, Okutoyi has worked with a number of organizations, the latest being the Liverpool VCT.
I started working within Redeemed Gospel Church, headquarters in Huruma, after training. Then from there, I went to MSF, Medicine Sans Frontiers, that is France clinic. Then after that, this is the time I worked with HF shortly. Then from there I joined the Liverpool.
At LVCT, he interacted closely with his clients, something that he says the USAID funding freeze has greatly affected.
We could mingle with the clients because you have to go and see the client directly in the house. You get the details from the client because some clients, like for example, a client coming in Kibra, sometimes we find it's so hard for the client to come within the facility because of one, maybe the person doesn't have transport to come to the clinic. Sometimes you find some people are busy doing their own issues. So the person will come to pick the drugs, but the person won't come for counseling.
Most of the people Okutoyi attended to are slum dwellers, most of them sole breadwinners of their families, and they tend to forget about their medication and focus more on other issues affecting their daily livelihoods.
You see, when somebody is on medication, this person depends on this medication. But if the person doesn't have the medication, then it means this person, one, will have a low immunity. That is an opening to most of the infections.
In 2023 alone, The President's Emergency Plan for AIDS Relief, better known as PEPFAR, delivered life-saving antiretroviral treatment to nearly 1.3 million people in Kenya. It also provided HIV treatment and counseling for over 3 million Kenyans, supported more than 600,000 orphans and vulnerable children, and helped employ around 43,000 healthcare workers across the country. At the end of fiscal year 2024, just months before President Trump's funding freeze, more than $174 million in HIV/AIDS program funding remained undisbursed. Okutoyi believes that by the government employing more community health promoters, the gap left by those affected by the USAID funding freeze will be solved to a larger extent.
The community health promoters are doing a very fundamental job, because within the community, they are the people who understand exactly what is in the household.
Okutoyi continues offering his services as a counsellor, but most of the time there is no pay, despite applying for jobs. He has thought of starting his own counselling services, but he doesn't have enough capital. Since the year 2000, a total of $8.3 billion has been disbursed for health support in Kenya. The bulk of this funding, 80%, has gone toward HIV programs. 5.99% supported malaria, while 3.15% was allocated for family planning. Additional funding was provided for nutrition, 2.4%, maternal and child care, 2%, and general health, 1.71%. Other sectors include water supply and sanitation, 1.68%, pandemic influenza and emerging threats, 1.58%, tuberculosis, 0.89%, and other public health threats, 0.21%. Directly affected by this funding freeze is Josephine Barasa, who started out as a mentor mother to young women at Kangemi Health Center and Kangemi Gishagi Dispensary in Kangemi, Westlands constituency, Nairobi County. She has been working for USAID from 2016 until the USAID funding freeze in January 2025.
When I joined, first I was working with young women. Why did I choose to work with young women? One, I realized in our community, there were a lot of young girls, especially teen moms, who were coming to our health facilities for help, especially when they got pregnant, when they dropped out of school, and they wanted to be counseled on how to go about their lives.
Josephine slowly became interested in gender-based violence advocacy, believing that she could be able to transform the lives of most of the young women who came to her for help.
I used to do health talks, that is, create awareness on the issue of gender violence. I also used to speak about the ability to go back to school, to get financial freedom, and things like that. And later in 2019, 2020, I'm not very sure about that time, I was picked as one of the beneficiaries from the county to go and train more about gender. So I acquired a certificate on gender violence, and since 2019 to 2025, January 24th specifically, this is when we learned that the USAID had frozen our support.
However, Josephine decided to continue volunteering at the two health facilities because of her passion in helping the community.
On a daily basis, I do what we call supportive counseling. In supportive counseling, I'll talk about the violence, and there I used to share stories of girls I've come across and my journey as a gender-based violence survivor. I've been looking around for like-minded organizations, call them churches, and a community-based organization where we get platforms still to talk about it. I also do work together with the administration, that is the chief, and the police officers. So anytime there's a case around Kangemi, I get phone calls, and I would guide them on where to start, what to do, what not to do, and then the kind of support I may come in and give.
In maternal and child health, Kenya received a total of 165 million US dollars in funding between 2008 and 2024. US support surged from just $6.7 million in 2014 to a peak of $24 million in 2019, before sharply declining during the COVID-19 pandemic. Although funding had started to recover, it has now been frozen. The freeze comes at a critical moment, just as the Kenyan government slashed its own budget for free maternity services by half, from 4 billion to 2 billion shillings. Now, Josephine's volunteer work is challenging.
I may get a distress call. Someone needs an Uber, probably to be rushed to Nairobi Women after a defilement or something of the sort. I'm not able to access those funds. A lot of people are having a lot of distress because they were used, like so many people are used to, if I just call, if I flash or flashback, I'll get a call. But at times, maybe I'm unable to come up with that airtime because I'm also having the financial challenges at the same time. Yeah. So financial challenges are there, and also that kind of support that the survivor needs may not be there. If you have realized in the facility, currently we have a shortage of staff. We have very few because most of us were supported by the USAID. So what we are doing today with most of the staff who lost their jobs from USAID, we have come up with proposals. We are doing proposals where we are hoping that we'll get donors who will fund a few of our activities so that we have the continuity.
Josephine encourages those who have lost their jobs to soldier on and try look for psychosocial support, because she believes this is a phase that is meant to pass. US government support has traditionally played a crucial role in recruiting, training, and retaining healthcare professionals. Without this vital funding, these gaps are set to widen, leaving essential positions unfilled. According to Health Principal Secretary Mary Muthoni, the Ministry of Health has positioned community health promoters, CHPs, at the heart of its universal health coverage strategy, citing their crucial role in delivering primary health care at the grassroots.
Our CHPs, literally, they are the ones who report mostly when there's any, when we have any public health event that has happened in a specific area. Their work is to look into 100 households. So within, that's a village. We have engaged our community health promoters. We have trained them to ensure that they have quick reporting mechanism through their digital system, and we have also trained them in regards to the practical referral system that they need to do, the nearest facilities that they need to take the patients or to guide the patients to run to. They have a kit that have commodities, equipment, and they have a smartphone because of record keeping.
The stop-to-work order in January affected Sheringham Elisha, a community health promoter, for 2.5 months. Sheringam lives with his family of 5 in Dandora Estate, Nairobi County. He is a linkage assistant for tuberculosis and chest X-ray and is currently working at Malaria North Health Center.
Actually, when the US administration announced the stop work order, it came with as a shockwave, and to me it was a big blow because I was told to stop working immediately. So I lost my job and also the income. So, and you know, I've been depending on that work to help my family for the upkeep, pay rent. pay other basic necessity.
Sheringham opted to continue offering his services as a volunteer at the same facility, where he also sought counseling services so as to manage his mental health due to the job loss.
After 2 months, 2 weeks, we were recalled back, and through the project of Community Health Service Project Kenya, that project has always been supported by USAID. So while we were recalled, we were told that we are going to sign a contract for 3 months only. So we signed a contract that is of June, July, August, and September.
And after the 3 months, he is not sure of what will happen next, but he is hopeful that together with other community health promoters, they will actively advocate for the rights of community health promoters so as to continue helping the community that is currently experiencing a gap left by some of the community health promoters who have lost their jobs.
The problem that the community members were facing during that time is that even the health system was not able to offer the basic essential health services simply because the staffs were out of work. And those staff who are working under projects, majority of them were out of work. And what was left there was a confusion because those who are employed by the county government or the national government were scarce. They were not able even to meet the needs of the patients that were working in the facility. We need to advocate for community health promoters to be salaried. Yeah, because they're doing a lot of work. They are the first front line of health services in the community.
According to Kenya's national TB program, the country records an estimated 133,000 tuberculosis cases every year based on its 2022 annual report. With support, TB-related deaths dropped significantly from 75,000 in 2010 to 23,000 in 2023. However, the recent withdrawal of this support now threatens those hard-won gains and risks shifting the burden back onto families caring for TB patients. By the end of 2024, the U.S. had pending commitments totaling $10.7 billion, funding that now hangs in the balance. For TB patients in Kenya, it's a massive loss of life-saving support. Community health promoters, CHPs, are the frontline responders in Kenya's rural and underserved areas, delivering essential care where formal healthcare infrastructure is limited. Despite the Ministry of Health reaffirming its commitment to placing community health promoters at the core of its universal health coverage strategy, some CHPs have found themselves out of work following the freeze in U.S. funding, casting doubt on the long-term stability of primary health care services at the community level. The cuts in USAID funding threatens to cripple several critical areas, including tuberculosis control, malaria prevention and treatment, HIV/AIDS programs, maternal and child health, immunization, and emergency responses. Malaria was the second most heavily supported health sector by the U.S. government in Kenya between 2001 and 2024. U.S. assistance for the top 20 malaria programs totaled around $497 million. In the years leading up to the funding freeze from 2022 to 2024, annual support remained steady at $27 to $30 million. According to a document titled Impact of the U.S. Government's Top Work Order in Kenya by the Ministry of Health, of the 80.5 billion shillings required for Kenya's national health programs, approximately 24.9 billion shillings is provided by the U.S. government. In light of the donor funding freeze, PS Muthoni has stressed the importance of strategic domestic resource mobilization to ensure the continuity of essential health programs and services.
Already in our country, I am aware that we are working on ways how we can bridge in the gaps by allocating funds for the gaps that we have in the country. Mm-hmm. And equally, through our FIF, we will be able to ring-fence a lot. The money that used to be reallocated will no longer be reallocated. So we may have funds that can bridge in the gaps that are there.
As the country navigates the challenges posed by reduced external support, it is imperative for all stakeholders, government, private sector, and civil society to collaborate in developing innovative and sustainable financing solutions. The current situation presents an opportunity to reimagine our health financing landscape and build a more robust, equitable, and locally driven health system for the future. For Willow Stories, I'm Nuru Abdulaziz.